Here, everybody. So as Keith said, my name is Natalia. I've been a member of the CSSC for many years and several in the capacity of a volunteer here on Vancouver Island, acting as the secretary now for our Pacific Rim chapter. So on behalf of the chapter and my fellow volunteers, thanks again for joining us here today. Just a little bit about our session. As you know, Colby Young is here. He's going to be presenting on behalf of the Vancouver Island Construction Association, VICA, the Tailgate Toolkit project. So this is an initiative that addresses really some of those significant impacts of the opioid and overdose crisis in the construction sector. This is a topic that probably some of you on the call, many of you, maybe all of you, you've heard about, and maybe it's connected or impacted your life in some way professionally or personally as well. This subject really first hit home for me when I was working as a health and safety manager in human and social services back in 2016. And at that time, overdose and deaths as a result of overdose were increasing amongst substance users. And my role in that position was really to support and provide solutions for social workers who are often responding to those overdose events and deaths, which can be very challenging and traumatic. So through that experience, I learned a little bit about the opioid crisis and the current toxic drug supply and how it impacts countless people. And as we know now, a disproportionate and large number of workers in the construction sector. So now I've left human and social services and I'm back working in construction, and it's just so clear that there is a need to support our workers. But how do we start those conversations, and how do we know what options are available out there? It can be a really tough conversation or topic to discuss in this setting. And so that's why, we're so excited to be able to share Colby's work with all of you today. Before I turn it over to him, just a little bit about Colby. So as was mentioned in the email here, Colby comes to us with a Bachelor of Social Work diploma in public sector management. And his prior experience supporting members of the community here in Victoria, those that were living with homelessness, mental health challenges, and substance use. We actually used to work together, so a little bit of a connection there, has really grounded and supports his belief in the principles of reducing harm to people that use substances or that are active in addiction. So he is now the program lead for VICA's Tailgate Toolkit, and his leadership is instrumental in sharing this information and these resources with us in the construction sector. So I think that pretty much sums it up, maybe a little bit long-winded, but thanks, Colby, for being here, and you can feel free to take it away there.
Excellent. Well, thank you, Natalia, for that great introduction. And good to see you again, as always. It's funny the connections that you make across different industries and the overlap that we've seen in these two different fields. So yeah, as Natalia said, I work as the program lead for the Tailgate Toolkit project. Now, this project is designed with the input of people with lived experience, both with substance use and with people working in trades and construction. And the goal is to really address the overrepresentation of people in our sector amongst those who are dying due to toxic drug poisoning. And just for the sake of this presentation, I'm going to be using the terminology of drug poisoning as opposed to overdose. The truth is that, that is the more accurate description of what's going on. We are no longer seeing that people are taking a dangerous amount of a particular substance. The truth is that people are intending to buy one drug and finding that it's cut with an incredibly toxic synthetic opioid, typically fentanyl. Now, I do have a presentation. I'm going to share it. We're going to go over some of the things that uniquely impact our industry. And I'm going to tell you a bit about the project and what we hope to accomplish with it. There's always room for questions. Feel free to raise your hand or yell or pop something in the chat. But I'm very excited to present it to you and also hear your input and your feedback. So let's get started. Hopefully I do this right. I'm notoriously bad at sharing my screen. There we go, looking good. Except for I'm not at the beginning at all. There we are. So as I said, with the Tailgate Toolkit, it is a project that was started Well, in 2021, and it was a collaborative partnership between the Vancouver Island Construction Association and Island Health here on Vancouver Island. Now, we are incredibly fortunate that our pilot period of 2021 was a success, and the province chose to give us a substantial amount of money in order to expand this project to the entire British Columbia region. So we are now working in partnership and support from the Northern Regional Construction Association, VICA in the Southern Interior, and Vancouver in the VRCA. So we actually have staff now located in the VICA and VRCA offices. We are looking to be able to offer services to the north as well, but it is a bit of a slower process, just given the geographic range and honestly also the lack of services often available in the north. So we are looking to expand a little bit there, but I want to talk about why we're here. As Natalia said, I think did an excellent job of introducing the fact that we are living through an opioid crisis. 2016 was the year that in BC we declared a public health emergency. And the truth is that was in response to the initial introduction of fentanyl into our drug supply that had increased the toxicity to incredibly poisonous levels. And we were seeing more and more people losing their lives due to substance use. And unfortunately, it's now 6 years later. The truth is it hasn't gotten better. It's significantly gotten worse. I'm not sure if anyone here is aware that we received some brand new numbers for 2021 just last week, or actually it might be 2 weeks ago now, in which we saw that 2021 was the worst year that we've ever had. So to put that into a bit more detail, in BC, we lost 2,224 people. Now, that is up 26% since 2020. So in just 1 year, we've seen such a substantial increase. And the trend has always been upward, So we are going to likely see a considerable increase next year as well. And it's really unless we start to implement some policies, some procedures, and some strategies to really, reduce the harm. So this is very much a harm reduction initiative. And for anyone who isn't familiar with harm reduction, can simply be described as understanding that certain activities in our society, in our daily lives, are inherently dangerous. And in lieu of being able to remove said activity, we have to address the harms and try to reduce the risk. For example, let's talk about a dangerous activity we likely all did today. Can anyone think of one? It's driving. It's driving, guys. Most of us drive. It's something we do daily, and it's something that has the inherent risk of injury or crashing or fatality. So we weren't getting rid of cars. So in lieu of that, we have addressed the dangers, right? So we do a number of things to ensure that driving is as safe as possible. We have laws, we have licenses where you have to be of a certain age and pass a test. We have paved roads and street signs, we have speed limits, we have seatbelts in case, no matter if all those methods fail, you still get into a car accident, that it reduces the risk that you may be severely injured. And airbags do the same thing. Now, we implement this strategy in construction as well, right? Inherent risk of injury on site. We have PPE, we have certain tickets that you have to have, certifications, licenses, safety plans, safety practices, first aid on site should all that fail. And the truth is that we need to apply that same lens to substance use. Substance use is not going anywhere. Any attempt to prohibit substance use has, honestly, it's failed. So when we look at substance use, we have to look at ways that we can reduce the harm. And a lot of the time it is education. There are, of course, we have things now such as safe injection sites or safe consumption sites. drug checking. We have even apps on your smartphone now that can ensure that somebody responds if you experience a drug poisoning. We have a lot of things that we can now use, but if we're going to really address this issue, it's going to be through education, it's going to be through reducing stigma, promoting help seeking, and really having tools and procedures in place to address these issues. So that's really why I'm here. I want to talk about some of the things that uniquely impact our industry and how we can better perhaps educate our employees, our leaders, in order to address this in a really unique and unified way. So let's run through a few things. In 2018, in response to this growing epidemic, the BC Coroner Service BC Coroner Service published a report that broke down the demographics of people who were dying due to drug poisoning. And the findings are somewhat shocking and may address some of our own biases. So first of all, we know that about 8 out of 10 people who die due to drug poisoning are men. And this is significant, of course, for our industry where it really is male dominated, but it speaks to a greater societal concern that this is a men's health issue. While it's an overall everyone's health issue, there is clearly something going on with men in particular that's putting them at greater risk, something that we'll need to address. We know that 69% of people were found to be alone. And I could ask all of you guys, and I typically do when I speak to sites, why do people use alone? But the answer is obvious. There's shame, there's stigma, there is just that concern of being judged. You know, we have a lot of stigma around substance use. And the truth is that that kind of judgment that puts people in a place to be using alone puts them at significant risk, as you can see there. Great. And finally, the stat that really started this whole project and this initiative is that nearly 1 in 4 people, 24%, are in construction, trades, and transport. So to add a little bit more context, the stat was originally provided as 55% of people who are employed are in construction, trades, and transport. And that broke down into 24% of overall. When we look at other industries, we are absolutely the highest represented. So let's take a look at this 24%. The next highest represented industry is sales and service, and they are at 9%. That's huge. And if we look at just the people who are employed, you know, we take up over half. Sales and service is about 21%. And then there's a few other industries that make up the rest. But there's clearly something going on within construction that we need to address. Now, I've highlighted these 3 statistics because I feel they're the most relevant to our conversation today, but I want to throw a couple more out there. 63% of people who died were found to be in their own private residence. So I think we all typically associate this issue with the street entrenched population. But the truth is that is not the case. While they certainly make up a large portion of people who are experiencing drug poisonings, we need to understand that this is happening for everyone in our community. Anyone who is using an illicit supply that is unregulated is at risk of drug poisoning. And we know in our industry, and this is coming from conversations with people, that cocaine in particular is very popular, but we also do have very functional people who use intravenous drugs such as heroin and other opioids. So it's really important that we address this and that understanding that this is something that impacts everybody. And I think, Natalia, you said something that was very pertinent to this in your introduction, is that for many of us, because this has been going on for so long and this has such a devastating impact, we can all likely connect with it. We all likely have some connection to someone who we either fear is at risk, someone who may have lost their life due to a drug poisoning, or interactions in the workplace. it's been 6 years. So this is something that I think we can all agree on. We need to address, we need to get a handle of. Now, our project started in response to these statistics. And in the spring of 2021, we wanted to really get to the core of what was going on. So we spoke to people on Vancouver Island who were in the construction industry, construction and trades, many of whom had lived experience of substance use, many of whom identified as being in recovery. And we also had a lot of industry leaders, so people who owned companies or were site supers. And we asked them a number of questions to try to address these issues. The first of which was, why are men in particular so impacted by this issue? And, you know, for the sake of time, I won't necessarily open it up to discussion, but I think we'll all agree on some of these points. Men typically are not, it's not acceptable for men to show weakness. A lot of us, we understand that men don't talk about their feelings. You know, we talk to guys on site, we ask them, why is this issue for men? We don't talk about our feelings, or they just won't say anything. And that kind of proves the point. You know, it's something that we have to acknowledge, is that we have a culture in our society that really, we don't teach men to show their feelings. We actively discourage it. So when we expect men to reach out for help, well, they've never been shown how. They've been told that they can't. They've been told that they shouldn't. So this has a huge impact on men actually seeking and receiving the help they need. What we often see instead is that, well, we keep it inside, we bottle it up to, you know, often very unfortunate circumstances. Now, these expectations of masculinity, traditional masculinity, that prevent us from sharing our feelings and expressing pain and weakness. And by the way, pain and our feelings, they aren't weaknesses, but we often have that perception, is something that continues to be enforced across generations, as it is a societal issue that we are seeing change. But because we all come to this with a different background, whether that is different generations, different cultures, we have different ideas around masculinity and toughness, right? We can kind of classify this all under a culture of toughness. And it's difficult. And we see this in our personal lives, whether it's family, but we can see this in the workplace as well. We have certain folks who, you know, really ascribe to an older way of thinking, you know, and I don't, this isn't coming from a place of judgment. The truth is, we all come to these beliefs from very valid reasons. You know, we grew up in a different time where there were different expectations. And we do see a lot of people who often will perpetuate these ideas because this is what we were raised thinking. This is what we were raised believing. This is how it was for me. Why shouldn't it be that way for them? I spoke at a site just a few weeks ago where I had that very similar response from actually a site super, where they were happy to share their own experiences, but very much expected others to man up, was often the expression used, right? That we could tough it out, get through it. It's not a big deal. But the truth is, we know often the issues that many people are facing are big deals. If anything, they're big deals to them, and they need to be addressed. So it's important that we recognize that this is something that is changing, but that these ideas do still persist. And like I said, the real outcome is that we bottle up those feelings. We don't seek out help. And for anyone, I mean, might be someone here, I can certainly speak for myself. If you've ever experienced a mental health disorder or a serious issue, say you're grieving the loss of a loved one, if you're not able to share that experience, it often spirals. You become much more isolated and you really internalize those feelings in a way that can have a massive impact on how you interact with others. But also, I mean, we know that substances are often used to cope, and they are quick, they are effective, but they're incredibly dangerous, as we've talked about. So we need other outlets that are supported, available, and that are not stigmatized, that we encourage people to access. Now, that's kind of the conversation around masculinity in men. Is there anything that anyone would like to add or that you'd like me to expand on before moving on? I'll take that as all right. We can save it till the end if something comes up. Now, something else that we asked them, why in particular is this happening in construction? And truth is, there's probably a lot of answers that are popping into our minds. Construction is honestly at a bit of a perfect storm. There's a lot of different factors coming together that attribute to that high percentage of representation. So let's get into it. What we heard from the people that we interviewed, there is a workplace culture. I think it's very tough to deny the fact that in construction, trades, transport as well, all these industries, there is a legacy of substance use. There is a connection there that has existed for a long time, whether it's perceived or real, that construction workers work hard and they play hard. And we see that perpetuated and we see that enacted, right? We see, the quote here is a great example. Everyone who works on a team gets into potentially the habit of going out together after the partying starts. At some point, cocaine may make an appearance. And that does happen. And I want to say first, this is a very non-judgmental lens that we operate this project through. We understand substance use does occur. Blowing off steam at the end of a work day, a work week, is not by itself a problematic thing to do. And in a lot of cases, it's actually very social. It can be great for team building. However, we do know that this is coming up a lot more for our industry than many others. And we do need to get across that currently the drug supply is just very toxic. You are taking a much greater risk than in previous years. And the truth is, with cocaine in particular, many people don't see it as being dangerous. They don't understand how incredibly toxic really every unregulated substance in BC has become. And it's difficult to get across, right? But we are seeing so much of that occur. So yes, a workplace culture does exist. And we do need to start making a shift towards more awareness of at least what the risks are. Feeling undervalued. Many people that we talked to about this issue felt that they were undervalued by their employer. And this comes from a few different practices. If you're working on a large team, you may often feel like a bit of a cog in the machine. That can occur in a number of different industries, workplaces, but it, for a lot of people, contributed to their own sense of value. So feeling, that your employer doesn't see you or see the work that you do or appreciate what you do can often come back in terms of how you appreciate yourself. And we see that does affect many of our workers' mental health and their willingness to also seek help, because for some, they don't feel like they deserve it. And this can also come across through some of our policies in terms of, many workers working project to project. You're not necessarily always going to have work. Being dropped between projects can be very difficult, can be very stressful, can be hugely impactful on your mental health. And it's something that for many of us, it's going to be unavoidable. It is a reality of the industry, but where we can certainly try to ensure that our employees and our colleagues feel valued. And that can have a major impact in terms of, them seeking help, whether it's externally or within the company. And let's acknowledge it's exhausting work. it's one of the hardest fields to work in. Let's be honest. I sit at a desk all day and I'm exhausted. So you put me in the field, I'm going to be worn out within an hour. And we have our guys working long days, long hours on tight deadlines. It's exhausting. And there are expectations that people can ride through it. Now, for many, they look for assistance in maintaining that energy. And this isn't necessarily applied to just the workplace. You're finished a day of work and you're beat, but you still want to go out and have fun and enjoy your time off. Well, things like cocaine can absolutely do that. So I just want to acknowledge that the folks in our industry do have valid reasons for using substances. Now, it may not be the first things that we would typically go to, but these are things that do exist and do have these perceived benefits for people in our industry. So a boost of energy, sure, that could be a reason why many people do use substances. It hurts. This is a very painful job. I can't think of another industry that is potentially as painful as construction, except for MMA fighting. And it's pretty close. Our guys are out there all the time, right? Whether it is, the risk of an injury or it's just long hours in the field, you're going to feel it. You're going to feel some pain. And we know the story of being injured on site, receiving an opioid prescription, and having that prescription end, and having that pain management piece either, fulfilled by illicit drugs, or you may actually be experiencing addiction due to the prescription and an improper plan to taper off your use. And we are seeing this much more often than we ever have. Now, years ago, when, once this crisis was really put out there as a public health emergency, we also saw a swing in the other direction. We saw that many people were no longer allowed to prescribe opioids. And this has also had a negative impact for the people who absolutely do need that prescription. So now they are absolutely having to turn to an illicit supply. This is a very complicated issue. When we talk about pain and pain management and prescriptions, things get very muddy. And the truth is, it's something that we need to ensure that our workers have a plan in place if they are injured, right? And I think every company has some sort of policy around that. So it's just something to ensure that people aren't coming back to work still feeling pain, or that they have a proper plan in place with the help of their physician and also your own HR department to ensure that it is a safe return to work. But when we talk about what contributes to the substance use in our industry, pain is huge. And again, these expectations of masculinity and toughness, this idea really prevents anyone from reaching out for help. And that could be using their benefits plan because they feel that that is also showing weakness, or just asking for help. We know in this industry that there is, for any industry, if you're dealing with substance use issues, that there is a duty to accommodate. So if an employee comes to you proactively and says, I need some help, that help's going to be there. But in many cases, people aren't going to reach out for it because, again, just this culture that we do have, both more societally, but also within our industry, that those expectations have really permeated construction and trades, and in part because it is such a male-dominated industry. So it's something that we really have to keep encouraging this conversation to ensure that people are reaching out for help when they need it. Okay, so we did these interviews. We got tons of feedback. It was all great. And we asked people, what are things you want to see to address this in construction? And with that input, we put together the Tailgate Toolkit, which has 4 components, which I'll go over now. The first, toolbox talks. For all of you wondering, that is me in the background with my hard hat. It is incredibly clean because I've worn it like 5 times. But Our toolbox talks are that we go out to a construction site and we present a toolbox talk. So a really brief safety meeting. Now ours are typically 30 to 45 minutes, and we just start the conversation on the work site. Much like I'm doing today, we acknowledge that this is a crisis impacting everybody. We acknowledge that men are greatly impacted, and that's an issue within our industry. But in order to kind of address the stigma, we have to have the conversation. So we talk about it, we talk about pain and pain management, our mental health. Mental health is, you can't talk about addiction without talking about mental health. And of course, we sound the alarm on the toxic drug supply, because we know people are still going to use, but they need to be aware of what they're using and the risk. So we also go over some harm reduction principles and how it can be applied to substance use. So we encourage use at a safe site, getting your drugs checked, using with people around. Like I said, using alone is the thing that puts us at the greatest risk. So this is a typical conversation. Like it's very conversational styled. It's really just intended to bring down that stigma and provide some awareness, And we always encourage people to use their benefits in these talks, go to their employer if they are experiencing issues, because that help will be there. And we do this typically in person, but we'll also do it virtually. So if you know of anyone who is maybe interested in signing up for something like that, we're always happy to do them. Our second component is supervisor training. It was identified by the people we interviewed that supervisors, leaders in the industry, human resource folk, these are the people who are going to be able to make change, and that's through understanding the contributing factors to substance use, being able to recognize when somebody needs support, and knowing what to do to offer that support. Our goal is always that if somebody needs help, that they get it, and that they have a job for them when they come back. We want to see people return to work. That's always the goal. So we have this course. We've developed it. It takes place monthly. People can sign up. We have open registration on our website right now. And it's 4 half days. So we usually do it from 8:30 to 12:30, 8:30 in the morning, 12:30 in the afternoon. And honestly, it's a great course. I'm very proud of it myself. We have guest speakers from Roper Grayall, which is employment lawyers who come in and actually talk about duty to accommodate, what our role is in this industry. And they're available to answer questions, because many of us have questions about the legal ramifications and liability. So it's always important that those questions can be answered. And I'll admit, I'm not a lawyer. My legal advice would be very unsound. So luckily we have the expertise of people in this field. We also have a representative from Pain BC, which is the largest chronic pain organization in the world. They come and they speak about this issue, specifically in construction as well. And they can offer a lot of supports, as well as answer a lot of questions for people in these roles about chronic pain and about pain management and how to best handle that. And we also have the head of Indigenous Studies at Camosun College here on the island, who discusses the impact of colonialism and the impact it's had on our Indigenous communities. So speaking about intergenerational trauma and things like residential schools, the 60s scoop, the millennial scoop that we are experiencing now, and the overrepresentation of Indigenous people among those who use substances but are also dying due to substance use. So these are things that we need to also understand. So the course goes into depth on all of these concepts and really provides the opportunity for leaders to learn and gain an understanding, so kind of get those foundations, but to also be able to have these skills, knowledge, and confidence to provide support. So also important to note, it's been recognized by BC Housing as being able to count towards continued professional development points. So you can receive 13 upon completion, which is always a great incentive. Yeah, really happy to offer this course. We've had great feedback from the participants we've had go through it. And since the piloting phase in 2021, we've made some adjustments to make it even more applicable for the industry based on the feedback we received. We also have print and digital resources. So these are things like we have a brochure that shows local service providers in the region. So if you are looking for harm reduction services, mental health supports, crisis lines, we have that in a handy brochure, and it is region specific. So currently we have that resource for the entire Vancouver Island, so South, Mid, and North. We have specific resources, and we're currently developing them for the rest of the province. It's a big province. It's taken us a little bit of time, but we're getting there. So now, for now, we don't have resources for every location, but if you're on the island, count yourself lucky. And we also do have a brochure that goes over some things about pain management. Because we know that's such a major piece and there are a lot of questions about it, it just walks you through some of the concerns, some of the questions you may want to ask a physician, and other supports that may be available, either through Pain BC or elsewhere. And again, we always can encourage use of benefits, pain prevention, and working with your employer to safely return to work. And beyond that, we also just have some posters that kind of provide some more information about our program and some of the other services that we offer. One of those other services is Hammer Time. Now, Hammer Time is an industry-specific support group. This was requested by many people who identified as being in recovery when we interviewed them, that they wanted something that was specific for them. So this support group is for people in trades, construction, and transport. It meets every Thursday night over Zoom. It's virtual so that we can really get anyone from the province to attend. And it is led by the Umbrella Society here in Victoria, which is a nonprofit with expertise in leading these types of support groups. The person who runs it, their name is Alex, a lovely young guy with experience both with substance use and working actively in construction. So he knows what he's talking about. And we tried to make this group as accessible as possible. So this is not a 12-step program. It's not faith-based. It's not abstinence-based. You're going in there to get the kinds of supports that you're interested in receiving and connecting with people who may be going through similar things to you. And that's the whole goal, is to really just create a support network. So that's Hammer Time. Really proud of that group. I'll admit the attendance isn't very high yet, so get in there while it's starting off. But yeah, I'm very happy that we are providing that, and that's a service that was very, very much asked for. So excited to see that take off. Like I said, this project now serves all of British Columbia. So if you know of anyone in any region of the province, we are happy to provide any of these services. So whether that's sending them some resources, doing a toolbox talk, either in person on site or virtually, or if they'd like to learn more about our supervisor training. All the information is available at TheTailgateToolkit.ca. And yeah, we'd be more than happy to provide more services to more people as we get this project really going across the province. So thank you so much for listening to me just drone on. Open it up to some questions. Now I can.
Sure, Colby, I'll shut down the recording and we can go to questions.
Sounds good.